Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about Molluscum contagiosum. Definition: Molluscum contagiosum is caused by a DNA poxvirus, Poxvirus, that infects epidermal cells. Clinically, the lesions appear as smooth dome-shaped papules that often are umbilicated. Molluscum contagiosum, smooth flesh-colored papule with umbilicated whitish center. And epidermis is usually thickened, containing molluscum bodies. Incidence: Molluscum contagiosum is a common childhood disease spread among family members, occurs but is uncommon. History: in adults, venereal transmission is suggested by a history of sexual exposure and the location of lesions in the genital region. Physical examination: the papules of Molluscum contagiosum are 2 to 5 mm wide, hard, smooth, dome-shaped, and flesh-colored or translucent. The papules have a central umbilication from which a cheesy core can be expressed. They occur singly or in groups, most often on the trunk, face, and extremities of children and on the genitals of sexually active adults. Uncommonly, they become disseminated, resulting in hundreds of lesions. If inflamed, they are difficult to recognize because of secondary redness and crusting. Differential diagnosis: the translucent papule of Molluscum contagiosum can resemble nodular basal cell carcinoma or a comedo. Nodular basal cell carcinomas typically exhibit telangiectasia and often occur in sun-exposed skin or older patients. Comedones lack umbilication. An inflamed Molluscum contagiosum may appear to be a bacterial infection of their skin. Differential diagnosis of Molluscum contagiosum include nodular basal cell carcinoma and comedo. Laboratory and biopsy: the diagnosis is usually clinically obvious. When doubt exists, a simple office procedure is confirmatory. The molluscum papule is removed by cortage and crushed onto a slide. This unstained material readily reveals numerous oval molluscum bodies when examined with a microscope. A biopsy is usually not necessary unless the typical features are masked by secondary inflammation. When in doubt, the diagnosis may be confirmed by expressing the cheesy core and smearing it onto a glass slide for microscopic examination. Therapy: treatment may be deferred awaiting spontaneous resolution. However, treatment is usually cryotherapy with liquid nitrogen or curettage. For children who will not tolerate the pain of curettage or cryotherapy, the careful application of the blistering chemical cantharidin can be used in the office, or topical salicylic acid preparations or tretinoin can be used at home, similar to the treatment of warts. The most reliable means of eradication is by curettage. The molluscum papule, composed of many molluscum bodies, is scraped off with some discomfort and bleeding. The topical immune response modifier imiquimod cream 5% applied daily has also been successful. Additionally, berdazimer gel 10.3%, a nitric oxide releasing agent, has been an effective treatment. The conclusion of therapy for Molluscum contagiosum: initial therapy is self-remission, cryotherapy with liquid nitrogen, salicylic acid, tretinoin, and cantharidin. An alternative therapy include curettage, imiquimod cream 5%, and berdazimer gel 10.3%. Course and complications: spontaneous remission often occurs within 6 to 9 months, although lesions have been known to persist for many years, and more lesions may develop by auto-inoculation. Individual lesions can become secondarily inflamed and may resemble furuncles. Involvement of the eyelids is uncommon but may result in chronic conjunctivitis. The development of hundreds of lesions with little tendency for involution should alert the clinician to consider immunocompromise. Molluscum contagiosum is one of the most common cutaneous findings in acquired immune deficiency syndrome or AIDS an AIDS-related complex infecting 9% of these individuals. In the patient with AIDS, Molluscum contagiosum is often recalcitrant to treatment and causes significant morbidity and disfigurement. Pathogenesis. Although it is difficult to produce lesions after experimental inoculation, Molluscum contagiosum is certainly contagious. Intimate physical contact such as wrestling or sexual intercourse or even sharing towels has resulted in transmission of their disease. The Molluscum contagiosum virus replicates in the cytoplasm of the keratinocyte, with resulting large intracytoplasmic inclusion bodies or molluscum bodies and proliferation of the epidermis. The center of the papule ultimately disintegrates, forming a crater and releasing molluscum bodies. Spontaneous involution results from a host immune response that is presumed to be cell-mediated. The stimulus that provokes this response after many months of inactivity is unknown, as with warts. Clinical case. A 9-year-old boy is brought by his mother because of multiple small bumps on his trunk and inner arms for the past 2 months. The lesions are painless and the child has no fever or itching. On examination, there are numerous small 2 to 5 mm smooth dome-shaped flesh-colored papules with a central umbilication. When one lesion is squeezed, a white cheesy material can be expressed. There is no surrounding inflammation or scaling. Which of the following is the most likely diagnosis? A. Verruca vulgaris or common wart. B. Molluscum contagiosum. C. Acne vulgaris. D. Milia. And E. Folliculitis. According to our explanations, the correct answer is Molluscum contagiosum. Explanation. Molluscum contagiosum is a viral skin infection caused by the Poxvirus. Lesions are flesh-colored dome-shaped papule with central umbilication, often containing a white cord-like core. It's common in children, sexually active adults, and immunocompromised patients. Spread occurs with direct skin contact or fomites, example towels and swimming pools. Differential diagnosis: verruca vulgaris or rough hyperkeratotic surface, and are usually HPV related. Verruca vulgaris is a rough hyperkeratotic surface and are usually HPV related. Acne vulgaris are inflammatory papules, pustules with comedones, and milia are tiny white keratin cysts without umbilication, and folliculitis are pustules centered on hair follicles and often are tender. Okay, this was an explanation about Molluscum contagiosum. Thank you for your attention.